Good day, viewers. Welcome back to DDM Health News Updates on our program, Your Health, Your Wealth. If you have not subscribed to our YouTube channel, please do it as soon as possible in order to get the latest news updates. A professor of obstetrics and gynecology, Abubakar Panti, has raised alarm over the rising trend of poor maternal nutrition, warning that excessive consumption of processed foods and sugary items during pregnancy could lead to gestational diabetes and other serious complications for both mother and child. Professor Panti, who is also the Honorable Chief Consultant of Obstetrics and Gynecology at the Usmanu Danfodio University, Sokoto, gave the warning while speaking on the critical impact of nutrition during pregnancy. He noted that gestational diabetes, a condition marked by elevated blood sugar levels in pregnant women, is often triggered by poor dietary choices and poses risks not just during pregnancy, but well into the future of both the mother and the child. Poor dietary habits, particularly the excessive intake of processed foods and sugars, can lead to gestational diabetes, which increases the risk of complications during pregnancy, he said. According to him, maternal undernutrition exposes women to anemia, preeclampsia, that is a hypertensive disorder, osteoporosis due to calcium and vitamin D deficiency, as well as delayed postpartum recovery and depression. They don't also emphasize that poor maternal nutrition doesn't stop at affecting the mother alone, but could result in lifelong consequences for the baby, including intrauterine growth restriction, premature delivery, low birth weight, and severe birth defects like neutral tube disorders. The mother can always recover, but the problem is usually with the baby. Some of the complications, especially infections and developmental delays, are permanent. One of the earliest things we see in intrauterine growth restriction, where the baby fails to grow adequately in the womb due to lack of nutrients, he explained. The further revealed that folic acid deficiency in early pregnancy may result in neutral tube defects such as spinal bifida, while lack of overall nutrients increases the risk of premature delivery and other neonatal complications. Professor Panti blamed the deteriorating economic situation and rising food insecurity for the declining nutritional status of many expectant mothers in the country. He expressed concern that the continuous rise in food prices and widespread poverty is limiting access to nutritious food, especially among pregnant women who need it the most. This aligns the previous report by Punch Healthwise, which revealed that many Nigerian pregnant women are forced to survive on just 2 meals per day and have minimal access to fruits and other essential nutrients due to economic hardship. Health experts quoted in the report warned that such conditions could trigger higher rates of anemia, preterm deliveries, low birth weight, and further worsen the country's already high neonatal and infant mortality rates, currently at 39 and 67 deaths per 1,000 live births respectively. Maternal mortality also remains a critical concern, with the country's rate standing at 512 deaths per 100,000 live births, one of the highest in the world. To curb the looming crisis, Professor Panti called on the government and stakeholders to strengthen health systems and implement targeted nutrition-focused support programs for pregnant women across the country. He stressed that improving maternal nutrition is a national priority with long-term implications for population health and development. Once children are not healthy, there is a problem in the future, he said. Next, a member of the Ogun State House of Assembly, Honorable Lukman Atobatele, has renewed calls for an increased budgetary allocation to the nation's health sector, warning that Nigeria must no longer rely heavily on foreign assistance to drive its healthcare system. Atobatele, who represents Abeokuta South Constituency 1, made the call during the large-scale free medical outreach organized for residents of its constituency in Abeokuta, the Ogun State capital. The outreach, which catered to over 2,000 beneficiaries, featured medical consultations and treatments for common ailments such as malaria, hypertension, diabetes, and asthma. It also included free surgeries for conditions like breast lumps, hernias, and cataracts. Speaking with journalists at the event, the lawmaker emphasized the urgency of boosting local health funding, especially in the face of dwindling international aid, particularly from the United States, which he noted has scaled down its global health contributions under previous policy directions. This outreach is not limited in Abeokuta South alone. It is open to anyone in need of medical attention. Government must do more. I am part of the government, and I believe our Ministry of Health needs to step up its game, Atobatele stated. The US, one of the biggest funders of global health initiatives, has reduced its support. We thank President Bola Tinubu for approving funds for HIV care and treatments currently, but that is not enough. We need a robust and well-founded health budget. We should not be waiting for foreign donors to drive out our healthcare goals, he added. The outreach also featured expert advice from Nigerian-born US-based physician Dr. Olabisi Jagon, who urged citizens to embrace routine medical checkups as a means of early detection and disease prevention. In the same vein, the officer in charge of medical services at the Ogun State Police Commander, CSP, Iheboro Minachiso, advised Nigerians not to ignore their health due to economic hardship. He stressed that health should remain a top priority regardless of financial circumstances. Some of the beneficiaries of the free medical initiative, including Mrs. Gloria Ope and Ms. Babarinde Stella, who both underwent breast lump removal surgeries, praised the lawmaker for his uncommon intervention. This program came at the right time for me. I didn't have the means to pay for surgery, but today I am pain-free. God bless Honorable Atobatele, Mrs. Ope said emotionally. They appealed to other public office holders and well-meaning Nigerians to emulate Atobatele's gesture by investing in programs that can expand access to healthcare for the undeserved. Next, in continuation, the Ogun State government has reiterated its resolve to revamp the water sector across the state, declaring that access to safe and clean water remains a fundamental human right, irrespective of political leanings or geographical differences. The special advisor to the governor on Sustainable Development Goals, SDGs, and water resources, Mrs. Damilola Otubanjo, gave this assurance during an inspection tour of water schemes in the Yawe axis of the state, including facilities in Ilaru and its environs. Yes. Otubanjo, who led a delegation comprises government officials and technical experts, said the administration of Governor Dapo Abiodun is determined to ensure that potable water is accessible to every citizen, as part of ongoing effort to enhance the overall quality of life in Ogun State. She noted that the present administration is not playing politics with essential services such as water provision, insisting that water, being a critical necessity, should not be influenced by zoning or political considerations. Water is not just a basic need, it is a driver of public health, economic development, and social peace, she said. We cannot allow such crucial resources to be determined by who voted for whom or where one comes from. Everyone deserves access. According to her, the visit to Yewa was the conduct on the spot assessment of the state of water infrastructure in the area, with a view to designing short and long-term strategies to plug existing gaps. She disclosed that areas under review include pump capacity, distribution network coverage, and the efficiency of water treatment plants, all of which may require significant upgrades or total overhaul. While commending the Ogun State Water Corporation for its dedication, Otbanjo acknowledged that more needed to be done to boost staff morale and ensure optimal service delivery. The team is vibrant and competent, but the system needs better working conditions, more funding, and strategic planning. That's what this administration is committed to delivering, she added. She assured her office to actively working with Governor Abiodun to implement targeted interventions that would restore public trust in the state's water system, stressing that all decisions are being guided by data, feasibility, and the potential impact on communities, not politics. Next, medical experts have sounded a strong warning to Nigerians against the use of unregulated supplements and herbal cleansers in the management of kidney-related conditions, stating that such products not only lack scientific backing, but may also worsen existing health problems. The nephrologist, who spoke exclusively on social media housewives, cautioned that many of these widely advertised products contain harmful substances such as undisclosed analgesics, alcohol-based solvents, and toxic chemicals capable of damaging the liver and kidneys over the time. A consultant nephrologist at the Lagos State University Teaching Hospital, LASUT, Dr. Amiso Muamini, expressed concern over the alarming trend of patients abandoning prescribed medications for untested herbal mixtures and supplements, often influenced by social media hype and anecdotal testimonies. These products are dangerous because we cannot ascertain what they truly contain, he said. Some are loaded with painkillers, alcohol, and other solvents. Continuous use can cause irreversible kidney and liver damage. We see it every day in our clinics. Muamini lamented that certain categories of Nigerians, especially ascertains and commercial drivers, are particularly vulnerable as they often resort to these so-called remedies in pursuit of strength and pain relief. We engage people in motor parks, construction sites, and other informal sectors to enlighten them. Unfortunately, many have already developed kidney disease before seeking proper medical attention, he noted. Speaking in a similar vein, another consultant nephrologist at LASIK, Dr. Theophilus Umoizudike, condemned the use of supplements and herbal concoctions without regular regulatory approval or scientific validation. He explained that unlike conventional drugs, which go through a rigorous multi-phase clinical trial process to test for safety and efficacy, most herbal products circulating in the market bypass this vital process entirely. Before any medication is certified safe for use, it must pass through phase 0, which involves animal testing, followed by phase 1 to 3, involving humans. Each phase checks for effectiveness, potential side effects, and overall safety, Umezidike explained. Sadly, these herbal mixtures and supplements don't undergo any of that. They are just mixed, branded, and sold with catchy promises. That's not evidence-based medicine, he added. The nephrologist warned that relying on these unproven remedies can accelerate the progression of kidney disease and even trigger new health complications. They further raised concern about Nigerians' growing reliance on health advice from online vendors, relatives abroad, and social media influencers. We have seen patients who bring supplements sent from the US, UK, or Canada, believing they are superior or curative. I always advise them to stick to clinically approved medications, drugs that have been tested and confirmed safer across continents, Umezidike stressed. Both experts urged the National Agency for Food and Drug Administration and Control, NAFDAC, to intensify efforts in regulating and monitoring the sale of unapproved health products, while calling on Nigerians to embrace medical advice from qualified professionals. Finally, amid the alarming surge in substance abuse among Nigerian youths, mental health experts have identified parental denial and societal silence as major contributors to the growing epidemics. According to psychiatrists, many parents and guardians are advertently worsening the crisis by shielding their children from accountability or refusing to accept that their wards are indulging in drug use. This is coming against the backdrop of a report by the United Nations Office on Drugs and Crime, UNODC, which revealed that 14.4% of Nigerians aged 15 to 64, amounting to about 14.3 million people, had used a psychoactive substance for non-medical purposes in the past year. The report also disclosed that 1 in 7 Nigerians within the age brackets consumes drugs, excluding tobacco and alcohol, with 1 in 5 high-risk users injecting drugs, predominantly pharmaceutical opioids, cocaine, and heroin. Similarly, statistics from the National Drug Law Enforcement Agency, NIDL, confirm that drug misuse is rife among children and teenagers, a trend described by experts as deeply troubling. Speaking exclusively on health, the Director of Research, Training and Health of Drug Abuse Units at the Neuropsychiatric Hospital, Aro, Abeokuta, Dr. Sunday Amosun, said many Nigerian families are in denial about the realities of drug use within their homes. When someone tells you your child was caught smoking or drinking, don't be quick to say, it's a lie. Denial is one of the biggest obstacles in tackling drug abuse within families, Amosun said. He noted that many parents and guardians react defensively when confronted with evidence of substance used by their children, a response that not only undermines intervention efforts but gives room for the habit to thrive unchecked. It's better to ask the hard questions early than to regret not acting when the signs were there, he warned. Dr. Amonson emphasized the need for training and retraining of teachers, religious leaders, and caregivers to recognize early signs of drug use and respond appropriately. He recommended that drug education be integrated into school curricula alongside moral instruction to raise awareness among students about the dangers of drug misuse. As we teach moral instruction, we should also teach drug education. Recreational activities in schools can also help reduce the tendency to experiment the drugs, he added. Amosun also encouraged religious institutions to engage in drug sensitization campaigns through sermons and youth programs. There is nothing wrong with preaching about drug abuse from the pulpit or during Juma's prayers. Everyone, parents and children alike, must be sensitized, he said. Also lending his voice, a consultant psychiatrist at the University of Benin Teaching Hospital, Dr. Kehinde Oderende, urged parents, guardians, and teachers to familiarize themselves with the behavioral and physical signs of substance abuse. He listed mood swings, secretive behavior, social withdrawal, and sudden changes in physical appearance, such as weight loss, bloodshot eyes, or poor hygiene, as red flags. One of the most obvious signs in the change in behavior, the individual may become irritable, anxious, or depressed without any clear reason. They may also begin to isolate themselves, he stated. Dr. Derinde further warned of increased risk-taking behavior, including reckless driving, unprotected sex, and financial recklessness, all of which could indicate an underlying substance use problem. He added that prolonged drug use could lead to mental health complications, including anxiety, depression, and psychological dependency, which may make recovery more difficult. The psychiatrist stressed that timely intervention, open communication at home, and community-based education are critical to curbing the rising tide of drug abuse among Nigerian youths. As the battle against substance abuse rages on, experts insist that breaking the culture of silence and denial is the first step towards safeguarding the future of the nations among the young ones and the new generation to come. Well, viewers, this will be all for now. Don't forget to click on the like button, share, comment, and subscribe to our YouTube channel, Gastro Digital Media. Thanks for watching. You have a lovely day. Bye for now. I remain your host, Nigeria Michael Nezumi. Bye for now.